All right, I'm going to do the oxygen device check off here. So I picked the simple mask and the nasal cannula. All right, before I go into a room, I'm going to look over the chart, evaluate kind of the doctor's orders before I go in to know why we are using oxygen. Sometimes the doctors order it, sometimes the respiratory therapist or the nurse will notice that their oxygen is dropping. So I looked over it all and I figured out how many liters and everything before I go in that they wouldn't be placed on to start them off. And I'll kind of evaluate them after I put on their device to see if the device is working. Some other things I might want to check out, maybe if there was an ABG done to make sure I'm getting them enough oxygen to bring up the ABG levels if their oxygen concentration is too low, or using the correct device that I'm making sure they're blowing off or anything with the CO2 levels. All right, so before I go into the room, I can wash my hands before I go in or shortly after. So I'm going to wash my hands before, and then I'm going to go in the room here. Hello, I'm Tyler. I'm a respiratory therapist here at the hospital. Your oxygen level's been getting a little low, and they wanted to start you on some oxygen. Have you ever used oxygen before?
I have not.
Okay, so oxygen, we're just going to start you on low. They wanted just to start you off with 2 liters, judging by kind of your vital signs and that you're just running a little low. And we're just going to kind of give you a boost until we're back up to the normal levels, and if we can start weaning you as needed. Okay, so before I do this, I'm just going to check your vital signs here. Let me get my... And so I'm going to check your vital signs, respiratory, the SpO2 before. Make sure you do that because that's kind of a big thing in influencing to see if the oxygen is working or we need to add more or less. Then heart rate and respiration rate, and see if the blood pressure is gone. You can chart that too. So I got all the vitals. Now we're going to hook this up. So on that, this is going to be a nasal cannula. And what it's going to do is just kind of slip in your nostrils, and you just breathe normally, and hopefully our oxygen levels will come up here. So let me get this connected. So when connecting this, we're going to use the wall outlet here with the Thorpe meter, and we're just doing the 2 liters, like I said. So I'm going to make sure I bleed out the line or test the line for getting debris out and all that. Make sure it's not confiscated. Everything seems fine. So we're going to hook that up to a little, I guess they call it the tree. Make sure it's on there good. There's no kinks in the line or anything, and then we'll get it to the oxygen. So I turn it up to 2. All right, then I'm going to place this just in your nostrils here, and we're going to go around your ears. Another thing you want to watch when you're using a nasal cannula, a lot of times on patients, if they're using it for a prolonged time or anything, it'll start rubbing on their ears. So there are some pads for that if they would need, so always kind of check on that. And also I'm going to make sure it's tight enough here. Okay, so it looks good there. Now after you place it, and they're on the 2 liters, you're going to make sure that they fill the oxygen, and you actually see maybe the oxygen levels rise on the SpO2 reading. Otherwise, maybe the oxygen's not going through the actual tube and not getting delivered to them. So I'm just gonna say that their oxygen levels are doing good. And then after that, we're just going to kind of let them wear that. After a while or so, we're going to reevaluate their oxygen. Maybe they've been at 100% for so long, then we can start weaning them down from maybe 2 to 1, or even get them back on room air as soon as we can, because you don't want to over-oxygenate and you don't want to under-oxygenate. So you always kind of got to keep eyes on their oxygen levels. So make sure you do the vitals again afterwards. And then before I leave the room, just make sure again that maybe the oxygen is in the room and on level. And make sure the call light's within reach, all the safe things, anything that you use, maybe throw away. Okay, so now I'm just going to act like I'm going to put the other device on and just go through the same thing. We're going to use the same liters and everything. We're just going to use a different device. So let me just show how that's placed. All right, now we're just going to use, it's the simple mask. Sometimes you'll use the simple mask if the patient maybe has, a dry nose, has problems keeping this in. Sometimes the mask is used if it's more confusing. Some patients more confused, and they tend to pull this out. Kind of the mask stays on a little better. Also, if they're mouth breathers, that's kind of a good thing. It'll go through the mouth instead of the nose. So here's the simple mask. Again, we're going to go through the same thing. Tell them what we're using, so this, how many liters, why you're using it. Before you place it, again, bleed the line, and then you're going to hook it up, Make sure that all the dust and breeze out. Again, verify that it's 2 liters. Okay, so we're just gonna place this oxygen mask. Place it around them here. And this will go right on their nose. And sometimes there's a little metal thing where you can tighten a little bit and it'll kind of tighten. Make sure it's sitting right where they're, it's getting delivered. Some mask might not fit the best, but just make sure it has a kind of a close seal around the mask. Again, you do the vitals before and after. And then make sure there's no kinks or anything. All right, so now say you're done with the oxygen. Shut it off. If there's a regulator, you can take it off and make sure you bleed the line. If they are done with oxygen therapy, if their levels have gotten high enough or you kind of discontinued. So again, just leaving the room, make sure the call light's in place, all the, I guess, safety issues, you know, the bed or the seats locked. Maybe if they get up, make sure you didn't mess with like a bed alarm or anything. And then make sure, you know, you kind of let them know when you're coming to check on them next, and then you can leave the room.